This is the Emergency Medical Minute, sponsored by Health One.
All right. Good morning, everybody. So I was going to talk quickly about a little study that kind of close to home, both in the topic and where it was done. So it was a study looking at capsaicin cream for cannabinoid hyperemesis syndrome, and something we see every so often, and it would make sense. This study was done at the University of Colorado. Good patient source for the disease. So, there's been this use of capsaicin cream, and maybe some people think it helps because, one of the things that helps these patients is hot showers at home, and maybe putting something that feels hot on their skin might help with their symptoms. That's kind of why it's been used, some people think. And then before the study, there were only about 20 patients that had actually been in the literature describing it. So this study was, looked at about 43 patients and looked to see whether capsaicin use decreased the length of time in the ED for these patients, and then also whether it reduced the use of other pain medicine and other antiemetics. And overall, there was a trend towards less time in the ED, about 20 minutes less time in the ED, and maybe a little less use of other drugs that the patients needed. They weren't statistically significant, but there's probably some benefit there. So, something that maybe is worth trying if a patient is willing to try it. Not a huge effect, but, sometimes patients are pretty hard to treat. So, any questions? All right. Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.